Well, good afternoon. How are you today?
Hi.
Welcome to
Hi,
the
Debbie
Debbie
and
Care
Kelly.
Show.
Where real people, real talk. From challenges to wisdom, conversations that heal, inspire, and empower.
We are so pleased today. We have an awesome guest
We do.
that's coming on and talking about a very serious subject. And I want everybody to listen and give your feedback after we're finished.
Yeah, we really want your questions because we don't want you to make any assumptions or jump to anything. We want you to leave here informed, empowered, and inspired to be your own advocate. So please help us welcome our wonderful guest, Miss Linda
Allen Smith. And she'll give us an introduction as to who she is, what she does, and just give us a little bit of information first before we start asking her questions about her journey.
Yeah.
Okay, my name is Linda Allen Smith, and I live in Greenville, North Carolina now.
She's joyous.
No, Winterville, North Carolina. And I am a medical nurse. I've done 40 years in the medical field.
Wow.
I've been a missionary nurse traveling for the last 18 years in and out the country. So right now I'm retired. So I'm more of trying to lean into of everyone being an advocate for themselves, especially with healthcare. We're coming into a new year. There's going to be a lot of changes. There's going to be a lot of people with no insurances because of affordability under Obama. And healthcare is changing a lot. So I think we, you as a person, have to put your fingers on your own health and be aware of what's going on.
Yeah, like Debbie said, this is a serious subject because this is our health and it's our responsibility. And so listen up. You're going to get some tips and some ways to approach it.
So why did you become a nurse in the first? What was the motivation for getting into nursing?
Really, I don't know. I graduated from high school at 16. I couldn't get a job, so my first job was in a nursing home.
Wow.
And I've done some research. A lot of the women on my father's side was in the medical field, so I guess it grew from there. Because on my mom's side, there's no nurses or anybody in the health field, so it just started there and it just grew. And I went to school and yeah, I worked in the field a little bit, but then I became more of an admin nurse. So I sit behind the desk, I manage. And then I worked for a doctor who, their church, it was a Korean church, they were big in missionary. So then I started traveling with them into Africa. And he taught me a lot in the third world and how to take care of patients. So that became a passion. So every year I was out the country in Africa. I done Katrina, the Congo raped women and children, Haiti,
Wow.
Dominican. So I've been in and out the countries. And by the grace of God, everything went well. I saw patients there. So it's a passion. It's not for everyone. So,
Yeah.
I always tell people if you can't go, support the ones that can go.
Can go.
So,
Absolutely.
That's
yeah.
awesome.
Beautiful. Yeah.
So tell us this, how did this missionary work shape your approach to healthcare?
Our, in the missionary work, they do not have hospitals, or if they have hospitals, you're working in the hospital with no lights. You might have dogs laying in the rooms with patients. You might have patients all together.
Wow.
They don't have the doctors that we have. They don't have the equipment. They don't have the knowledge. So my role of going was sometime, bringing the medicines in the country. We set up clinics and treat patients. So it opens your eyes to you know, of people that are not able to get the care that we do. And we even have people in the US that have insurance that do not take care of themselves. They don't go to the doctors. And
Mhm.
when I was working in the medical office, we would say the patients would come in at the last minute and they would be a train wreck
Mm.
and you would know where to start. It's like, what have you been doing? How, it would take us forever to get them on the right treatment plan.
Mhm.
So I've always, you know, tell people at least go for a physical.
Yeah,
At
once
least
a
you get
year.
one.
Yeah.
At least find out what your family history is.
Mhm.
If your mom or dad is diabetic, there could be a 50% chance you're going to be a diabetic. If you have cardiovascular, high blood pressure, there could be a chance that you're going to have it. And I did not know my biological father they had really bad cardiac problems. And I didn't find out till later that his mom and dad died of heart attacks. He had a
Mm,
pacemaker. I have a pacemaker, and three of my half brothers have pacemakers.
mm.
So that's being aware of, this is a history. I need to stay on top of it. And I was in Kenya, Africa, and had my first heart attack. There was no
Wow.
Mm.
medical, it was only me. And
Wow.
by the grace of God, I converted back because I have ventricular tachycardia. It's what athletes drop dead from.
Mm.
So
Wow.
somehow I knew something was wrong. So I got up and started walking. And the missionary house I was staying at, they couldn't speak English and I couldn't speak Korean. I was
Wow.
by myself. So
Wow.
they got me down and massaged me and cooled my body down because
Mm,
usually your body heats up.
mm,
Mhm.
And God
mhm.
wasn't ready for me. So I was able to get back into the country and I had another episode and I wound up with a pacemaker.
Oh,
Wow.
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 Wow. S
So, yeah, it's
Wow.
been a journey.
So this latest journey that you had with the medical issues, I'm not trying to be specific about what happened, but you went through a lot a
Hmm.
couple of years ago by
Right.
being misdiagnosed. Give us
Correct.
give us a little bit of background about that and how that came about with your
Okay.
background.
What happened about June? 2 years ago, I had been out shopping and I came home and, after we go shopping, if you shop a lot, you got to take a nap. So I laid down and I took a nap and my husband works at home. So I called him on the phone. I said, I can't move. And, he came downstairs and, I couldn't move. I couldn't get out of the bed.
Wow.
I was in excruciating pain. I'm screaming. And he had to get my office chair and rolled me to the car to get me
Wow.
to the ER.
Mm, mm.
So we go in and they automatically said I had sciatica. And I
Mm,
said, no, because I'm active. I'm on the go. And I said, I don't think so.
Mhm.
So they did all the tests and everything. And they still stuck by I had sciatica. So they gave me a bunch of really happy drugs. So I was able to get home, IV drugs. And that sustained me for about 3 days because they gave me some pain pills with it. We went back again in 4 days. I'm screaming on the top of my lungs. I still could not walk. So they admitted me and said it was sciatica. And in the emergency room, I said, I think you're wrong. And they knew my background. I'm a nurse. And I said, I really think you should call an infectious disease because I
Mm,
had fever and chills a
mm,
couple weeks before. And that's an indication of cardiomyopathy. So,
Mm.
I said, I think we need infectious disease. And they said no. So the 4 days I was in, they never called in orthopedic. They did some tests. They never called in infectious disease. So 4 days they sent me home. And if anyone knows it's hard right now to get into specialists, even to see your primary care.
mm.
So I was going from specialist to specialist to specialist, and everybody said, we don't know what to do. And they still stuck by sciatica. And, I could not walk. I was in a walker and a wheelchair. I went from
Mm,
shopping to a walker in a wheelchair and then pain.
mhm.
So, I had 2 injections in my back. Uh, it took 3 people to get me on a table on my back for them to put the injections in.
Mm.
And it subsided, for a little while. And then we went on vacation. So, I'm like, okay, we had planned to go on vacation. So I went in a walker, in a wheelchair,
Wow.
and we got there because all my family was there. And they said, if you get here, we'll take care of you.
Mm,
And it's like, okay. All I have to do is fly and everybody's there. So on the way back, it was gradually wearing off the medication and the injections. So when we landed, we were living in South Carolina. This is where this all happened. Um, we got, I got off the plane and my husband took me straight to the emergency room. From there, they admitted. Then they're like, "Okay, something's wrong." So, they came in 3 days later because they did blood cultures. It takes 3 days for a blood culture to
Culture.
grow.
wow.
And they came in and they said, "Unfortunately," and that's a really bad word for
Your
me,
meat, yeah,
fortunately,
unfortunately, yes.
um, "You have an infection in the joint of your hip." So, by then, it's like I I had lost all faith in them, and they said, "We have to transfer you out to another
Excuse me, I'm sorry.
hospital in South Carolina," and I said, "No." I've called my sister because I'm from Virginia. She's on her way. She's flying in tomorrow. And they said, "You can't." And I said, "Yes, I can." And they said, "You're
Sorry.
flying out against medical advice." I said, "I am." And they
So
go,
so
"Insurance won't."
they didn't want you to leave their medical system to
They
go
wanted
to
to take her to
another.
another one, infectious disease people,
Well,
right?
they felt I was too sick to do this. I was, like, not walking, I was on IVs, I was on pain meds, and they said, "Insurance might not pay." And I said, "Well, then you're gonna be the ones that's not getting paid along with everybody else." I
Yeah.
really don't care because I'd rather die trying to get help than my exact words was, "For you guys to kill me here, so I'm out."
Um,
So, fortunately for me being in the healthcare field, I had my cardiac doctor and he said, "If you can get here, I'll have the team ready." So she flew into South Carolina.
Your
My
sister.
husband got me from the hospital and took me to the airport. And 3 hours later, I was admitted in the cardiac care unit. The hospital in South Carolina never addressed the cardiac part of it. They just
Mm.
knew once they knew where the infection was, it was going to spread to the wires of my pacemaker.
Oh, wow.
So they needed to find the hospital to take my pacemaker out. And by that time, I had lost faith in the
Mhm.
doctors.
Mm.
I just told them, I tried to, say, I think you're wrong in being polite, and they didn't listen. And it caused, with them not listening, and I feel like if they would have got infectious disease doctor in sooner, it would have saved 6 months. It
Mm.
took me
Mm.
6 months to get back on my
Wow.
feet.
Wow.
Wow.
And
Yeah.
it's to the point now with me, I've lost the trust in the profession that I've known since I've been 16. People will, patients will come to the doctor and they don't know what's wrong with them. They're not listening, they don't know the name of their medicine, but I was abreast to all of that. I was a good historian, and for me it's like you're wrong. And I stood beside that. And so I stayed altogether in that 6 months. I was in the hospital a month and a half.
Wow.
In and out.
Wow.
I had three surgeries
Wow.
to get my pacemaker out. All the
Mm.
wires had to come out.
Mm.
And then it stayed out for a month and a half, and I had to wear a vest in case my heart went into arrhythmias. I had to do IVs at home. And then I got my pacemaker in, and it was implanted too high. So I had to go back in and get it lower.
Mm.
Wow.
Wow.
So it's been a
So
journey.
can I ask a question? When they say it's planted too high, what does that mean?
What happened is once I got home, the way it was implanted, if I laid on the right side, it would thump the whole night. And
Oh,
if I couldn't sleep on the left
left.
side because no, I couldn't sleep on the right side because of the hip, and I couldn't sleep on the right side because of the thumping. So all
Mm.
this was on my right side.
Oh,
So
wow.
it was just, and I have a lot of scars from all of that. And by the grace of God, my husband took care of me.
Mm.
If it wasn't for that, I would have had to stay in a rehab. I was
Mm.
Mm.
total I couldn't walk, I couldn't get up, I couldn't do anything. And
Wow.
I think I cried every day from the pain.
Mm.
So,
Mm.
and in
Mm.
saying this is being your own advocate. You know, for me, I pushed, but it's like the doctor said, we were not used to someone coming in with a real problem. They go to the first
Mm.
diagnosis that they're used treating, and that was sciatica. And I go to the cardiologist and I'd be like really upset. And they said, unfortunately, we did get it. And I'm like, unfortunately, you almost killed me. So,
Mm. Mm.
oh, or I think three doctors use unfortunately. And
Mm-mm.
it's still, I don't use the word. It's very painful saying it
Yeah,
right.
Yeah.
because they're saying like,
So,
So what is what I guess we can hear in your voice the emotional toil from going through all of this, and at the same time as you're going through this, you lost your mother in the process. So
my mother, I buried her 2 weeks, came back to Virginia. And then 2 weeks from the day I buried her, I laid down and I couldn't get up. So emotionally, I didn't heal from losing my mom because, it's
mm-hmm.
business, getting everything done. So I get back home and it was just what's going on. It it was so traumatic, and my feelings were so up and down emotionally
Sure.
that
That's
I suppressed a lot. And we came home. I couldn't stay in South Carolina. Soon as I got on my feet, we sold our house.
wow.
I told him I can't stay here.
Mm,
Emotionally, I was scared of getting sick again,
mm.
and we
And
didn't have family there. So it was
mm,
us 2, me and my husband. So
Excuse me.
psychologically, it did a lot to me. I just finished going to therapy because um I became so angry, just angry that
that they
they
wouldn't listen.
Yeah.
they didn't
And not
listen.
only that,
I
they're not listening cause you a lot of harm.
I felt like I should, and I'm like, did I push enough? You know, what's going on in today's healthcare that it's a lot of things are overlooked until it gets to the point that, okay, let's look at something else. But where they were waiting to look at something else, my heart was like shutting down,
Mm,
and there was infection on all the wires.
Mm,
And it's like, okay, this is it does happen. I'm not saying that doctors intentionally make mistakes. They are human, and almost advocating that people need to ask questions.
right.
mhm.
You are your own spokesman. Ask
Yeah.
those questions. Even now, when I go to the I have 14 specialists now for what happened to me,
Wow.
Wow.
because it's not normal to get an infection in the SI joint. That's the
Mm,
sacroiliac joint of
mhm.
my
Okay.
right.
I'm glad you said that because I was like, what does that mean?
Yeah.
Yeah, so it's not normal for that to happen, and a lot of the doctors here have never treated that. So they'll send me to another doctor. It's like,
Yeah, well, at least they're trying to get you to somebody who knows more than they do.
Yes.
well, because when I go to any doctor now, it's like I tell them, I'm gonna ask questions. I'm gonna
Yes.
ask more questions than you want to
As you
answer.
should. Yeah,
Mhm.
And
as you should.
I tell them, as a nurse, I know nursing, I know medical, but you need to start like, I don't know anything, and then let the conversation flow. I will not let them change any of my medicines. I'm on 13 different medicines. Most of them are heart medicines.
Mm,
And, it's like I asked them, I'm on 13 medicines, but how do they interact with each other?
Yeah.
right.
And that's a
Need
And,
good
to know
question
that.
that
Yes.
patients do not ask. That's
and,
awesome.
are, where are they all going at one time? And which one of them know what to do? In fact, they had put me on one medicine, and I woke up and I saw the walls were painted in roses. And I'm like, I don't think this is right.
Yeah.
So
Yeah.
my husband was awake. So I'm like, do you see it? And he's like, no. I said, the whole room is painted in roses. And he's like, close your eyes and go back to sleep. So we knew that was a side effect.
Mhm,
It's
mhm.
like, so, but I knew to like come off of it.
Yeah.
Uh, and that's what I'm saying. Ask questions.
Yeah.
Healthcare next year is going to be going in a different direction. You know, people, I just heard on the news, her insurance doubled.
Wow.
So you're going to be less likely to go to a doctor or a specialist at that. And more people are going to wind up in the emergency room like I did.
Mhm.
And you don't want to be one of those they're going to push through if you know they are not, it's not right what they're saying. I mean, everybody doesn't have that medical experience, education as I do. So it's like you've got to almost say, are you listening? Um, it's like when I first came here to North Carolina, when the heart doctor said, I need to take you and reposition your pacemaker. And I told him, no, you don't know me. You don't know anything about me. I just walked in, and next week, you want to take me in the emergency room? You don't know me of what I've been through. So, they'll kind of look like, okay. And I just said, no. I flew back to Virginia. The heart doctor I see in Virginia, he has been with me 11 years. I can
Okay.
call him. He knows me.
Is he the
And
one that
what
put your pacemaker in?
he was the one that put the first pacemaker in 12 years ago.
Okay.
Okay.
And he was the one I called. I just said, hi, it's me, it's Linda. He knows me personally.
Mhm.
And I said, this is what's going on. He said, can you get here? And I said, yes. My sister will fly and get me. And he had a team ready. And it's like he said, I know you. I knew when you came in, you couldn't walk. I know that it wasn't sciatica because he's taken the time to develop that rapport.
Mhm.
And doctors and they need to take that time to listen to you, not rush us through as a number
Mhm.
and just say take this, and then it's like, what is it? So in saying this, we have to stay on top of this, especially for the African American people. We have more problems with heart disease, high blood pressure, diabetes. These are our number one problems. And you have to rely on yourself instead of relying on the medical, because medical doctors, nurses, they're not gods. They're went to school, they have treated a lot of patients, but they have to define the care to you,
So
not
how do you do that? Okay, so if you got a new doctor, do you ask them for a consult before? Are you able to ask for consults? Because if they're rushing you in and out, sometimes you don't have time for that. What do we need to do in order to have that time?
paperwork. When I go to a doctor, I have my paperwork in order. Okay. Every time you go to a doctor now, they'll give you paperwork,
Mhm.
what your visit was. I have that in my phone under medical information. I have all my medicines written down. I have, the dates in my phone of when I've had surgeries. I
Okay.
have, next of contact. So it's building your medical history where you can recite it.
Yeah.
You know what's going on with you. Um, and that's what I tell patients when I see them. I don't know what that little yellow pill is. Uh, do you? And they're like, no. So
Yeah.
it's like being aware
Yeah.
that
Yeah.
this is for my diabetes. And the older patients we get, you almost have to have someone to advocate for you.
Mhm.
It's like pulling a medical history from a person, it's like it's hard to piece together. And it's like, where do we start
Right.
to treat you?
Right.
And most consults right now, you have to go to your primary care, then they refer you out. And it could take 3 to 4 months to get in with a specialist. So
Mhm.
the more you're on top of it, you're saving time.
Awesome.
Yeah,
Awesome.
that's
So, and
good
and same,
information, and sad that we have to do that,
and
you
if it
know.
could happen to me, it could be happening
J-
to others,
mm,
Millions,
Yes. Yes.
millions.
especially the ones that don't speak up and like, okay, okay,
Yeah,
it's it's not okay. And
no.
I know a
Or
lot of,
30.
they'll say stay off the internet, but read up, take and read and absorb what you know. And when you go to the doctor, take that information and ask. You could be wrong or you could be right. It
Yeah,
can open that door to your help
Mhm.
with your care.
yeah.
Mhm.
Don't let
So
them
it's
just dismiss you or
correct.
dismiss what you're
And
saying. That's a flag right there, right?
it is. And most insurance companies, well, we're dealing with insurance companies now. Even Blue Cross Blue Shield, I think last year it came out that if you're in surgery, they give you so many minutes for anesthesia. Like if you're having
Oh my
back
goodness.
surgery, okay, we'll
Wow.
give you 30 minutes. Then you have to document. And that was, once it came out, it was quickly dissolved
No.
Mm.
because
Yes.
you can't put a time
Uh, no.
on
But they needed
a
the whole
surgery, an
surgery.
operation.
Mm,
So, is a
mm,
lot of medical care and prescriptions, are not controlled by the doctors. Okay. It's the time, the medicines, it's controlled by insurance companies.
Mhm.
And you read how many kickbacks, not really kickbacks, they pay the senators in Congress to lobby on their behalfs. Medicines on the TV that, you're always seeing commercials.
Constantly with a
Those are
litany
not
of side
the
effects.
generic medicines. The generic and they never tell you how much they cost.
no.
So my medicines can range from $750. Two of them, but I'm on a grant. But I have to have this disease in order to be on the grant to
Mm,
help with the
mm-mm.
coverage.
Wow.
No.
If not, the insurance companies will charge that. The blood thinners I was on, because I had a blood clot in each lung.
Mm.
So it's been a journey. And, I'm still angry. I
Mhm.
There are days I still have problems walking, and those are the days I'm most angry.
Mhm.
And
Mhm.
I had to go into therapy to I'm gonna have to live with it.
Right. Right.
And, it's like, I question myself, did I do enough
Mm.
to get the care I needed? So
I, of course, as you know, have uh, have the holistic approach, which everybody is not ready for that.
mhm,
But what I will say, the what I have come to appreciate is the holistic doctors, by and large, know the body and understand it in a deeper level than the medical doctors, because the medical doctors are trained to
mhm,
diagnose things that they can treat with drugs, whereas
right.
the holistic doctors they're looking at the root cause. They're looking for the root cause so they can help to alleviate it. And and they're also looking, like you said, people will wait till the last minute till they're almost dead to go to the doctors. And where if you're going the holistic route, you will be highly encouraged to be proactive about your health, and also be able to recognize things that the other doctors wouldn't think anything of. They wouldn't, think, for example, blood work. The blood work tells a lot, as you know. And but when you're looking, if you're looking for certain things in the blood work that are indicators of potential problems down the road, and not right now, but down the road, if this continues, and not just a one measurement, but the trend of what's low or what could be too high. And so all of these factors are factored in when one approaches it from a holistic perspective. I just want to say that because, that the picture that what you experienced is terrible. I wouldn't want anyone to experience that. And I'm not saying every holistic practitioner is perfect or ideal, but just like you said, ask the questions, ask the questions. And I just feel, I just know, because I lost my faith in those doctors a long time ago, probably 40 years ago. And have been going to either naturopath or chiropractic or some holistic type of practitioner. And just want people to know that you have options. Because especially if your insurance you can't afford your insurance, holistic doctors don't charge that much. They don't charge that much at all. In fact, when my husband is working with the person, well, this not for long, but he's not charging anything. But he's looking at your blood work, and he's very smart. Looking at your blood work, and he's looking at the indicators to see what is happening, because he understands how it all interacts and what's needed to support all these other functions that most doctors are not aware of. And yeah, so I just want to encourage people to look at those options too.
That's why I'm saying I encourage people, if you do one thing for yourself, get a physical every year.
Every year,
Get some
every
blood
year,
work.
and then
And if
compare
you
your labs.
And if you don't have insurance, it's like I went to my doctor the other day. It's a big sign. We don't take Medicaid anymore. And I'm like, where are those patients going to go? And those are the patients that that need the most care, because these
Exactly.
are the patients that have not really taken care of themselves as they should. Um, most people will wait till something happens.
Yes.
And even
Yes.
for me, I had been, because I knew my history, know some of your family history. Okay. Um, I knew we had cardiac issues in my family, but I never knew the extent that I was going to go into VTAC in Africa. And so we got that under control, but I never knew that it would come back to bite me. As I was healthy, moving about, and this was the last thing I thought that, and they still do not know where the infection came from. They have no idea what happened. And during that time, I was in Virginia taking care of my mother.
Mm.
And it's like, okay, something. Then when I got time to really think, it had progressively gone, the infection had gone through my body.
Did
Mhm.
you have any early symptoms, like before you went shopping? I just want to understand this part too. You were taking care of your mother at the time that you went shopping?
No, no, no. I live in North Carolina then. No, I was in South Carolina then. Um, I had went to the emergency room because I was having fever and chills. And,
Before
chills
you
so
went
bad.
shopping?
Then, I went to Virginia. Then I was okay. I had saw one of my doctors in Virginia, and he had put me on antibiotics. And, I came home. It was 2 weeks after I came home from burying my mother.
Mm.
And that morning, I had an MRI done because I went to, a gastro doctor because I just had a colonoscopy, and I'm thinking, "Okay, did they nick something? Is
Yeah,
something wrong?"
yeah.
So, when something I know who to reach for when I need something. So it's like, let me call him up, could something have gone wrong doing that procedure? And, we did the MRI. So I had the MRI. I had taken myself to breakfast. I had said it had breakfast that morning and came home. And, it's like, okay. And just laying down, just laid across the bed. And and it's like something's wrong. And I think, could they have done more? Yes. They did the normal test that you do, but to diagnose what was going on with me, you needed those blood cultures. You have to show if something is growing.
Mhm.
And I I usually know how to take care of myself, diagnose. I'll go to the doctor. I have this, that, and the other. What do you think? But I have already gotten to the point I need to go that extra step. But I feel like if that one ER doctor would have listened, would and then sometimes they come back to the point is she's telling me what to do,
Mhm.
but
Yeah.
I wasn't far off.
But the
No, not
arrogance
at
the
all.
arrogance of the doctors, just to say that the patient doesn't know what they're talking about. But, I this is a fantastic, conversation, but we're running out of time. So, in
Well, thank you
closing.
for sharing your story because
Yeah,
people need this is like a wake up.
yeah.
Wake
Yeah.
up and know that your health is important and guess whose responsibility is? Because guess who's going to be suffering if it doesn't you? So you got to take responsibility for your health. Ask the questions, ask for the specialists, you know, get get your get your questions answered.
One
Keep
of the
asking till you
things,
get
Keep
the answer.
asking, keep
yeah,
asking.
I want to share after I got at the hospital, I sought legal advice. I
Uh-huh.
knew and they knew that they made
A
a
mistake.
mistake.
Mhm.
And I could not find one attorney to take my case.
Wow. Wow. Wow.
It comes because it would have been a long court case. It's
Wow.
unless you
Wow.
lose a limb or something's really bad.
Mm.
And the point is, th- there comes a time to say they were wrong. I was right.
Mhm.
And the cost is the cost was 6 months of my life
Yeah.
on different medicines. Like I said, I'm at 14 specialists right now. Everyone's
I'm still baffled that you can't find a lawyer to take your case. That just boggles my mind.
it's it's not, it would be a long case. We got the paperwork. I talked to many of them. No.
Yeah.
And along with the anger of that and the anger of what happened to me, it it there's some days I get more angry, and I've had to have therapy to deal with that anger. And
Good for
I
you.
have
Good for
to
you.
learn
Yeah.
Because
not.
that's
And at this point, when I go to the doctor, I'm straight to the point.
Mm.
And
yeah.
it's like I tell them, it's not that I don't trust you.
But I don't
You don't
I'm
trust
know
gonna
what
you.
I've
come
been through.
trust you.
I don't trust you.
Yeah.
Yeah,
Yeah.
I'm gonna be part of all decision making.
Decisions. Yeah.
Absolutely. And
So,
we
Absolutely.
all should be a part of our, especially if you're like you have the background, you have the medical background, you definitely, absolutely should be a part of of any decisions having to do with your health.
right. And like I said, I've seen a lot like your holistic medicine in Africa. They do a lot of holistic there. But
Yeah.
it's,
All of it, all holistic isn't the same. For example, when I go to my holistic doctor, the first thing he does is he connects me to this machine that, based on frequencies, finds out all the things. It sees parasites and all emotional stuff. It just sees everything that's going on with my body. And then that same machine generates, based on frequency,
A report?
no, not to, it does the report. It's doing the report the whole time while I'm there connected. But then it generates the anecdote for all these things that are going on with me energetically, and it fuses them into some things that I take that are giving my body what it needs to address all of those things. Not all of them, because I think when you first start, you probably have 10,000 of things that are going on. But the top, I think, 1,000 or somewhere in there. Maybe I could be 100.
Yeah.
But as you keep going back, you have less and less things that are going on. But he sees COVID, and then I have drops to take to uh, address the COVID. So it's a lot deeper and a lot more comprehensive than some places that are more simple. But it's come a long way because it's also been evolving over the years, and where the doctors are able to muscle test for what's going on with a person, whether all the different organs have um, ways of letting you know that, or letting the doctor who knows what they're looking for know what's going on with you. How healthy is this liver? How healthy is this pancreas? Or the yeah, all the different organs in the body, and so that they can know, also learn what does it need. It lets the body tell them what it needs and how much of what it needs. So there's no misdiagnosis because the body is intelligent. Every single cell in our body knows what it
I
needs.
think that's a good approach to be. But most of the time, when we show up at the doctors or emergency rooms, time has passed so much, and the disease have taken, you know,
And
over.
they don't use those kinds of devices.
Mm-mm.
They don't use
No,
them.
they don't. We don't.
Yeah.
We don't use those because we're in the acute phase of finding out what's wrong.
Mhm.
And of course, there's a pill for everything. So
Yeah.
later,
Yeah.
I think transitioning to that, it
I
would be
hope
a
so.
lot.
I would love to see that. I would love to see that. I have an extraordinary doctor who's worked in the reservations, the Native American reservations, and they have labeled him as a shaman because he's healed so many people and
Yeah.
animals
Yeah.
there. So, but there are other doctors, I'm sure, because for every one that we have special, there are more around. And so I say that to say, don't think that you have to go to my doctor because you're way in, Virginia or wherever.
I'm in
But
North
look
Carolina.
for North
North
Carolina.
Carolina.
But look for a doctor that resonates, that your heart says, yeah, this person, I can trust this person. You really want to go to someone that you could trust.
And I think she's done that with her doctor that
Yeah,
she's
the
been with for the
cardiologist.
cardiologist that you've been with for 12
And does
years.
he
Yeah.
recommend you to any other doctors that he trusts?
What I do is I have the work, like I just had an echocardiogram. I fax it to him and he takes the lead. It's like I told him in the message, you've brought me a long way. You've been with me. You know me.
Yeah.
So even if they would have said after that, you need to have this surgery or this, I would have told them, no, you don't know me.
Mhm.
You've
Yeah.
got to know my personality, my body, my history.
Yeah.
And until I have that comfort level with you, I go back home because
I don't blame you
Go
one
back.
bit.
Yep.
That's
Go
right.
back to
And
home.
you said you've got 14 different specialists that you're working with, and those specialists, but whatever they are recommending, you're taking that back to your cardiologist,
he
or
just
or
if it
he.
wasn't for my heart, I would be fine. It's the cardiac, but it's affected my hip, so that's the orthopedic. Then there's the orthopedic surgeon. Then there's the vascular surgeon. Then it's the cardiac surgeon. Then there is the electrophysiologist. There is a little bit. I'm everywhere. In 1 year, I have 14 specialists because
Wow.
when I walk in and I pour out the history, like, oh, well, this is my
uh,
field. I need to refer you.
yeah. Yeah.
So, you know,
Mm,
by the grace of God, I'm
yeah.
here. You know,
Yes.
Yeah.
Yes. And for a
um,
reason.
Yep. Oh,
For a
yeah, I
definitely for a
know,
reason.
reason.
I
For a
know.
reason.
I'm
To make
saying, how did I come out of Africa? You know, after a heart a defect and make it back. So God's not done with me yet.
Got a
Maybe
lot.
I'm here to tell the story.
yes.
People know your bodies, get help.
Yeah.
We've got to keep fighting for health care here.
Hmm.
It's
But
gonna
you said
be
it. We got to take responsibility
And know
for
our
at least doing
bodies.
what we know is right.
Yeah.
Yeah.
right.
Know our
And
bodies. Yeah. And
if
listen
you
to our
don't get
bodies.
that one answer, don't be scared to say, well, I don't think so.
Hmm.
You know,
Yeah.
it's like I told him, I said, I'm out. He like, what? I say, I'm leaving. My sister's in the air. I'm
Hmm.
gone. You know, I
Yeah.
I
Good for
knew.
you. Good for
Yeah.
you.
Good
And
for
That's
more
why
you.
you're
people
still
have
here.
to say, can we bring somebody else in to I need to get another opinion. There's nothing wrong with getting a second opinion.
Opinion.
That's right.
Mhm.
That's right. Second,
So,
maybe a third. Because and don't let the doctors know that this is a second or a third opinion, because they may not want to, not want to
Go
go
against what
against the
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 other
other
person
doctors. They kind of stick
recommended.
um,
together.
I'm
Yeah.
very it's like I tell them, I'm very upfront. I'm more upfront than I've ever been.
Hmm.
I just come right out, and it's like, "We wanna put you on this," and I said like, they wanted to start me on narcotics, and I said, "No,
Good
I'm
for
not
you.
going to do that. We want you to go to pain management." I'm not going. I'll exercise, we'll go to other ways, but I'm not gonna let you start me on narcotics yet.
Good for you.
Yeah.
Good for you.
So
Yeah.
I'm
Yeah.
not saying there are days I don't get out of bed. I'm not reaching for the Tylenol, okay? It's right beside my bed.
Yeah,
But,
yeah,
it's mind over matter too.
yeah, yeah,
Yeah.
A lot. Yeah.
yeah,
I
I'm
mean,
gonna
yeah,
but
get
you're
up
right.
and I'm gonna do this and take some more Tylenol. So,
yeah.
but anyway,
But
that's my
anyway,
story.
Well, thank you
I'm
for sharing
sticking
your
to it.
story.
yeah, thank you for sharing
Yeah.
that
Yeah.
story.
People need
Thank
to hear
you.
it.
And
Yeah,
and don't be scared to ask. Ask. Speak up. Ask.
This is your
You
life,
know,
your body,
it's-
your health.
so
definitely.
so I want to say thank you
Yes. Thank
for
you for coming on.
mm-hmm,
And
and we appreciate
mm,
we
mm,
appreciate you.
yes. Yes.
So
That's
thank you for tuning in to the Debbie and Kim
so. And
show.
remember, you are perfect for your purpose for being here now. Yes, you are. And
And
don't
don't
forget
forget
to
to
like,
to subscribe
subscribe, like, and
and
comment.
comment. We
We
love
love
hearing
hearing
from
from
you.
you.
Enjoy your week. Bye.
Okay.
Bye.
Thank
Happy
you, Linda.
holidays.
Okay.